Hi guys, so today I'm going to discuss hyperthyroidism with you people. So, do you actually know what is hyperthyroidism? See, I'll tell you what is it. Hyperthyroidism is basically a condition in which the level of TSH is below its normal range, okay? Now you will find out the normal range and write in the comment section below. Okay, what is the normal range of TSH? So it is basically below its normal range. Then the T4 level and T3 level is increased. Okay, in case of hyperthyroidism, TSH level is low and T3 and T4 level is increased. So this is the condition in which it is hyperthyroidism. Okay, now I'll tell you the sign and symptoms, because many a time I've seen this question. It is being asked in this form. They can either ask you write about the clinical feature of hyperthyroidism, or they can ask you write about the sign and symptoms of hyperthyroidism. Okay, this is very important and you should know this. Okay, so first of all, before moving ahead, let me tell you what is the sign and what are symptoms. See, signs are the features which doctor sees. Like whenever a patient approach a doctor basically look for these features. So the features which are looked by the doctor, they are called signs, and symptoms are the features which are presented by the patient. So whenever a patient comes, he or she narrates his or her problem. That is the symptoms. So he is basically telling you the symptoms. So symptoms are the features which are told by the patient. Okay, I hope it is clear to you. Now I'll tell you what are the symptoms which are seen in hyperthyroidism condition. See, we are having hyper in this condition, like hyperthyroidism is having hyper in as a first letter. So what you can see is, this is just for the sake of your learning, I've made this mnemonic. See, hyper means hyperactive. Patient is hyperactive, so the first thing, patient will be hyperactive. So if the patient will be hyperactive, so there will be some kind of weight loss. So obviously there will be weight loss. So there will be weight loss. If there will be weight loss, the patient will feel fatigue. Yes. So the third thing is fatigue. If the patient is fatigued, then he will have tend to have the more kind of food. So his appetite will be increased because he wants more food because he is fatigued. So increased appetite is the fourth point. Then when his appetite is so much increased, he has eaten up a lot, now he will be having diarrhea. This is just for the sake of learning. ही विल हैव पॉलीयूरिया. ओके, सो ये हम ऐसे याद कर रहे हैं कि पेशेंट ने बहुत ज़्यादा खाना खाया, तो ही विल बी गोइंग टू वॉशरूम very frequently, so he'll be having diarrhea, he is having polyuria. Now what happened, the patient become very irritable. Okay, so the seventh point is he is irritable. So there is irritability, and also there is heat intolerance because he is sitting in the washroom, so he is heat intolerance. Okay, I know it's funny, but it is just for the sake of learning. I hope now you will never ever going to forget this. Okay. Now moving on to the signs. See, what all signs will the doctor see? Whenever a patient enters into a clinic, so doctor will, the thing which is visible to doctor will be goiter. So because it is enlarged in the neck, so doctor will be able to see it. Okay, he is having goiter because that's the kind of swelling he would see. So that first point is goiter. Secondly, doctor will ask the patient to, just show me your hands. So this is just for the sake of learning. Okay, so he will ask the patient to show his or her hand. So he will touch the hand, he will see the skin is moist, so it is warm and moist skin. Okay, thirdly, when he is touching and he is palpating, so he will see there is atrial fibrillation. Okay, so the third sign is atrial fibrillation. Okay, he will also see that there is tachycardia because when he's touching, he's seeing, okay, the warm skin is moist and warm, and also there is atrial fibrillation because he could feel it by palpating. Then he will also see there is tachycardia because he could sense the pulse. So he will see, okay, there is tachycardia also. Then the patient, he will leave the hand and he'll see, okay, there is muscle weakness. So there is muscle weakness. Then also there is proximal myopathy. You know the proximal myopathy? If you don't know, then please search it and let me know in the comment section. Okay, then also, now he has seen the check the patient. Okay, now the patient is going back. So while walking back, he sees the patient and he sees that he is having leg lag. Leg lag means he is walking in a very, he's not walking properly. So there is some imbalance in his walk. So that is leg lag, and also he is having tremors. Okay, so I hope it is clear to you. This was very basic and very simple. Okay, thank you so much. If you really liked it, please hit the like button.